Hey, this is Brandon Sowers running for Congress here in Arizona, and we're back with another great episode with Marion, and we are going to help go after healthcare reform because our goal is to have the best healthcare system we possibly can have. We know that there are tons of baby boomers that are retiring or have been retired, and their main concern is Medicare, Medicaid, and their healthcare. Marion, is it possible for us to actually have a better system than what we currently have with better care and better services for all of these baby boomers that are concerned about the healthcare system?
Oh, heavens, yes. And I would encourage these baby boomers to start to understand the system better. And especially what I've been doing since 2018, where is the money going? Because if you, the baby boomers, think about this, what is it that you need for healthcare? Well, you need prevention, which you can do a little bit of on your own. You need a physician to help you. The physician has some staff members, some nurses, perhaps. Occasionally, you're going to need medications. Hopefully, you don't need to be hospitalized, but if you do, you need the hospital. If you need the medications after the hospital and even before, you might need a pharmacy to help you out. You get care from all those touch points that I just mentioned. But if we insert a lot of fat into the system, the middlemen, right? So there's pharmaceutical middlemen, there's hospital middlemen, the insurance companies themselves are middlemen. And when they're sucking so much out of the system, now we cannot afford to pay all those components that I just described. And I'm seeing, like in my own profession, physicians, they're leaving the system, they're going off, they're working for industry. Pharmacies, independent pharmacies are closing, several hundred in Pennsylvania just in this year alone. And sometimes they served as the only place that a patient might be able to go to get some advice. We're seeing a shortage of medications. A couple years ago, we didn't have antibiotics. We didn't even have Motrin. We didn't have normal saline the year before that. We're losing supplies because we're paying middlemen. So could we have a better system? You bet your boots we can. And we can have a better system if we trim out all the fat. But you got to see where the fat is. You got to see where the money's going. If you want to keep on sending everyone's tax dollars to the great gaping maw of middlemen, I can't help you. But if you want to understand how you can extract it from them and start having people, maybe some middlemen in the system, but more, what should we say, ethical ones that are giving a little bit more value rather than just sucking it out of your pockets. And then maybe you can have more access, longer appointments, pharmacies opening again. Maybe you can have hospitals that are actually able to be staffed well with physicians, surgeons, nurses, PTs, OTs, respiratory therapists, the kinds of things that actually give you care. But if the care is not there, good luck.
Yeah, it sounds like there's a lot of meaningless subsidies that are going to waste, to fat, to even the insurance company CEOs. And so, from your perspective, if we had a magic wand, we said this again in other episodes, how would you transform this healthcare system? Would you keep Obamacare? Would you change it? What would you do for the American people so we could have a better system for them and more meaningful?
Well, let me state very clearly in all of my writing, I haven't gone and said, let's repeal Obamacare. That's the answer. Just like saying, I want Medicare for all, repeal Obamacare and Medicare for all are simply slogans. They're bumper stickers, and all they do is start a partisan healthcare food fight, right? So, Obamacare, are there a lot of problems? Absolutely. I mean, when it was first written, I think it was an 800-page bill passed. No one saw what was in it. There were two good things that Obamacare did. Those two good things, number one, it allowed patients, no matter what was going on with them, they were able to get coverage. Okay. And then number two, they were able to keep their children on their insurance until their children were 26. But there's 800 pages extra here, and there was a lot of stuff in there that wasn't helping. And then because of a lot of the regulations that got added, because HHS got enormous power under Obamacare, Health and Human Services, the secretary. So many more thousands of pages of regulations were written. Those regulations caused a lot of consolidation. That consolidation took away independent hospitals, independent surgery centers, independent physician practices. Now we're seeing the effects on the independent pharmacies. The consolidation happened such that the insurance industry consolidated into several companies, and then they became vertically integrated with others. So they bought up the pharmacy middlemen, they bought up the pharmacies. When those pharmacies close, who do you think's buying them? It's the big box pharmacies that are owned by CVS Health. So you had a situation in which now we have a gigantic set of really powerful people in healthcare that are consolidated. I'm not saying we need to smash through everything and start over, but we need to unwind that consolidation so that these people can't be all attached to the hip. Because when they're attached to the hip, now they have perverse incentives. Just imagine you walk into CVS and they have a minute clinic there because you can't get into your regular doctor. So you go in, you actually don't even really see a doctor when you go to CVS many times, but whoever that person is, maybe they have prescribing power. So they can prescribe you something, and then they're going to send you to the pharmacy counter, and maybe they'll send you to 4 aisles in CVS to tell you to buy extra stuff. But CVS owns the pharmacy counter. They own the person who, did the prescribing. They own the PBM that CVS pays to actually pay the pharmacy. So it's sort of like a money laundering operation, right? Now you should be asking yourself, did that person tell me to get the drug because it makes the whole CVS empire the most money? Or did they tell me to get the drug because it's the right drug for me? You see the problem of the perverse incentive. It makes a lot of money for CVS, but it really should cut down into everyone's trust. So repeal Obamacare? No, but these subsidies, we're also paying too much for them, and we're paying them directly to the same insurance company complex that I just got done telling you about. And that's not right either because they're not the people that are actually giving you your care.
Yeah, it sounds like we gave up our convenience, to get convenience, but we gave up our localization on services. So if my son, for example, grows up, he wants to be a doctor. Hopefully, we don't get into 200 to $600,000 in debt, and he's absolutely brilliant and cares for people. How hard would it be for him to get a hospital locally so he could provide incredible care locally to his community?
Well, first of all, your son couldn't get together with a bunch of other doctors and own a hospital because that was outlawed in Obamacare, which is
Wow.
unbelievable. Imagine if, someone came along and said, "Hey, lawyers aren't allowed to own law firms, chefs aren't allowed to own restaurants, blah blah blah." It just seems un-American, and I'm standing in front of the flag for a good reason here. I mean, we're supposed to be free market capitalism. Everyone claims that the reason that our healthcare is so messed up is because, oh, it's capitalism. But it's not capitalism. When you restrict ownership, that's like restricting trade. That's not free market. When you can't see the prices and shop and be a consumer, that's not a free and open market, is it? When you're allowing, we've talked about this before, the insurance companies own those pharmaceutical middlemen. Those pharmaceutical middlemen put together the formulary, the list of drugs that are covered. Well, guess what? Those pharmaceutical middlemen are allowed to accept kickbacks from the pharmaceutical companies. You don't know that you're getting the best product. You're probably just getting the best product that kickbacks can buy, right? That is not a free market. So if your son then, even if let's just say, okay, he can't get together with his friends, put together a hospital, get the best quality products he wants in that hospital. So now he's going to work for a hospital. Well, I mean, is the hospital going to put restrictions on him? I don't know. He works for the hospital. Who does he speak for? Does he speak for the patient? Does he speak for the hospital? I'm not saying every hospital does this, but there are cases of hospitals that were encouraging their ER doctors to do more admissions because they didn't have big enough admission rate. So if we got to fill the hospital, says the hospital to the doctors, and then patients are getting admitted, are they getting admitted because they really need to be? I mean, really terrible, really terrible.
Yeah, it used to be a time where you could be a doctor for 40 years or 30 years and look back in your career and say that was a really meaningful career. I helped a lot of people. I did the best I can for them. And now it looks like it's just, you're going through, like you said, your career and working for that hospital, which is really whoever's behind it and the insurance companies. And now your career is actually meaningless. So is it possible that we could introduce a bill, or there might be a bill already out, where we can actually make doctor careers meaningful again?
Well, there's many bills that are going to need that are needed to do that sort of thing, right? And then, so the first thing I'll say is I wouldn't say the answer should be a bill. The answer should actually be the American public unwinding, understanding what's needed, and trying to create it, but doing that in tandem with making it possible to do, right? Just like I told you, actually, physician owned hospitals are known to be places of quality. We have a shortage of hospitals, a shortage of doctors, a shortage of access to doctors, and we're restricting access to new ones when there's doctors out there that want to open a hospital or expand one. That's crazy. We can't keep doing the same crazy. So reversing the ban on physician-owned hospitals is really needed. There's also state-level laws called Certificate of Need, in which the state determines whether or not there's a need for a hospital, and they can kind of put the screws to you if you're trying to open one, right? That's also ridiculous. Even if you're not a physician, they can do that. And of course, the big hospitals just want to keep their places open and running and cut down all the competition. There's laws that allow, or actually they prevent what we call site neutral. So site neutral would mean we would have site neutral if under Medicare, which I know a lot of our listeners who are boomers are interested. Um, Under Medicare currently, hospitals can collect many more times the same payment that an independent physician's practice can. And if you're a physician who works for a hospital, like your practice is owned by the hospital, they collect more at that practice too. So like if you're a surgeon and you are independent, not owned by the hospital, but you sell your practice to the hospital takes over. Now all of a sudden, if you're giving an infusion for your patient with rheumatoid arthritis and it's a Medicare patient, Medicare is going to have to pay 3 or 4 times more for that infusion now that you're hospital owned. That is abject fiscal folly. I mean, why pay more? Everyone should be saying to themselves, chant it with me. Why pay more? Why pay more? That's crazy. And that's like taking your Medicare money right out of your pocket. It's taking everyone's Medicare money. How do you think this program is ever going to be able to remain solvent? Another big thing that we need to do is we need to really hammer down on price transparency. So there's a great price transparency bill. I wrote about this in an article, I think it was called C2T2, like R2D2, right? It's easy to remember. Consumerism, competition, transparency all lead to trust. So C2T2, very easy to remember. And it's a terrific bill that was put out in the Senate by Senator Marshall of Kansas, and he had a Democrat co-sponsor, Hickenlooper from Colorado. This is bipartisan. I mean, we should all want this. Transparency. Patients Deserve Price Tags Act. That's what the act is called. And this is no act. This is a solution, because once patients can see their price tags and once employers can see their price tags, currently the employers are not entitled to their own claims data. Did you hear me, America? They're not entitled to the claims data on the patients for whom they're paying their health care, even if they're self-pay. So then they're trying to figure out, where can I get my health care and how can I shop for it? They can't. They need that. So I've
Yeah.
described to you a couple things we can do to make that happen.
You definitely hit a great point. If there was a service, or now with AI, but if we had pricing transparency and empowering the employers to be able to shop around for the best service with the best pricing, now they're optimizing for the affordability, and we're seeing costs going down. So, as a potential future congressman, how could I help? What would be something that I could do for the people to be able to create more affordable, better healthcare in the United States?
Well, you're doing it right now. And I'm going to advocate a little for myself. I'm a bit of a truth teller. There's a lot of people that are not happy with some of the things that I'm saying, but I'm not speaking for them. I'm speaking for patients. So you found me and you said, "Can we do these podcasts?" So you're getting the word out, and I think that's incredibly important. So you're doing one of those things. Another thing that you could be doing, like, if elected, and I'm hopeful for you, um, would be that you would be thinking about some of these issues here and realize that some of the issues that I've mentioned, and we should talk about one more in a minute and talk about those middlemen PBMs, but some of these issues have become so calcific because the people who have been in DC the longest, they don't want anything to change. And part of it may be out of habit. Part of it may be because, you know, they climbed up the ladder and they want to stay in their ladder of power, and that makes them have to do all this fundraising. I mean, it's an unsavory fact, but it's a true fact, you know, that they have to do that. But I think what we have to do is that Americans have to start to understand that all those people, whether they're at the highest level and running the US Senate, or whether they're a first time congressman, all those people under the dome of the Capitol, they work for us. They work for we the people. They don't work for them, the corporates. They work for we the people. And I think even at the highest levels, they have to start to understand they might have to do some uncomfortable things that will make some very wealthy people mad, and they may lose some money. But guess what? Votes are more important than money, number one. And number two, wouldn't you sleep better at night just knowing that you did the right thing for the patient in a setting where healthcare is outrageously expensive? People can't get it. It's sucking away 20% of our GDP. But we can't go on this way.
I love that. I've been talking to a bunch of people, and one great phrase has been more fathers, less government. And I feel like the more family oriented, congressmen or women that are in there, then they are actually focusing on bills for the next generations. So if they are going to corrupt America, they have to look at their young little 4-year-old daughter and say, it was me who did that. But that 4-year-old daughter can also hold that father accountable and say, are you going to make this future better for me? And vice versa. So when I look at my grandparents and my parents and my 4 children, everything has to be around that lens. So how do I help my mother and fathers to actually retire in a way where there is incredible healthcare and they don't have to pinch pennies? And so someone like you is advocating for that. And we know pricing transparency is key. We talked about that before, where there are sometimes cost savings of $32,000 between two hospitals because of price transparency. I love we talked about that in the past. Also, more physicians to be owning hospitals. And one thing I want to advocate for is the localization of community support. So, we don't need a big federal government. We need more local. We need more localized government, more even churches and communities. So imagine your local communities having funds that can support your local doctors to have their own hospitals, right? So now we're empowering the local community to actually get a return on investment on their own people. And so instead of like you said, like the big box groups owning everything, it's actually the local communities owning everything, and there's more accountability. So you have a third thing that you want to talk about with that fat that's in there that we need to get rid of. Let's actually dive into that right now too.
Yes, and I'm glad you brought that up. So we're going to talk about a father in a minute here, a real father that lost his son and really should not have lost his son. But I want to echo what you said about churches and community. Several years ago, I went with a group of Black pastors to Washington, D.C., to offices across the aisle to advocate for reform for these pharmacy benefit managers and to advocate for transparency, because these Black pastors had churches, and what they told me was our patients are getting sick, they're going into the hospital, or they get cancer and they need a certain medication, and the prices are through the roof, and we are fundraising for these families or these patients in our community, in our churches. And they're like, this seems outrageous to me. And I said, it is outrageous, like, so the hospital prices are up because there's no transparency, and the pharmaceutical prices are up in part because of these pharmaceutical middlemen, PBM, pharmacy benefit managers. There's three big ones. They're owned by the three big insurance companies. Those three big PBMs control 80% of the prescription drugs in America. There's a couple additional ones that work through Medicaid managed care. And I mean, there's cases where it looks like they're committing fraud. At least they're settling for $1 billion. The biggest Medicaid managed care organization, Centene, settled for $1 billion over potential fraudulent activity. Maybe they just felt like, oh, we have $1 billion, we'll just give it up, because they pay their CEO $20 million, the company that runs the most Medicaid managed care. In any case, let's get back to that father. So those PBMs, they are also tasked with creating what we call the formulary, the list of drugs that is covered, right? Well, there was a father in Appleton, Wisconsin, Bill Schmidtneck. He and I talked last week. In 2024, in January, Bill's son, Cole, who was 22 years old, went to go pick up his prescription for his preventative asthma inhaler. It had protected him for years. He went to pick it up. All of a sudden, he was told this is not on the formulary. He looked at the price tag. He decided, I'll go without. He had gone to a big box pharmacy to pick it up. The big box pharmacy did not offer Cole Schmidtnecht an alternative. He left without his preventative inhaler. Less than 2 weeks later, he was dead after a massive asthma attack. Imagine, I have a 22-year-old son. And, like for me to hear this, when I first read this story, it took my breath away because I've been advocating for PBM reform since 2018. It hurt me as a human, as a physician, as a mom, that this man lost his son because the formulary changed and we've left these people in power. Honestly, it really made me mad at everyone in Washington, D.C. that's been fooling around and not getting PBM reform done. Sick. In any case, the reason that his father has become such an advocate is he figured it out. And he figured it out because Bill Schmidtnick, the father, had the exact same insurance by the exact same company because they worked for the same company. And when he went to his little mom and pop pharmacy, the pharmacist told him, it's not on the formulary, it would cost you this much, but I'm going to work with you. I'm going to get you an alternative. And that's when Bill realized what happened to Cole because he didn't know until then. And so he has become this powerful advocate. I am so honored because next week I'll be on the steps of the United States Capitol on the lawn. We'll be advocating for good, solid PBM reform, the Pharmacists Fight Back Act. It's going to do all the things. The fact that these PBMs can get kickbacks, you're not going to keep those kickbacks, PBMs. Now the money's going to go to the patient. It's going to allow independent pharmacists to get paid a fair price, right? They're going to give you a floor and they're going to give you a ceiling. And that's not price controls because it's a market based rate that these independent pharmacists will get paid. It will remove steering. So now these PBMs can't steer towards their pharmacies, whether that's their big box pharmacy like Cole got steered to, or whether that's their specialty pharmacy that can be online, kind of. But you're going to prevent the steering. This PBM bill, the Pharmacists Fight Back Act, this is what I'm going to DC to fight for. And after hearing about a man who lost his son, a father who lost his son, who now spends another holiday. This is going to be his second holiday without Cole. He has a beautiful wife. He has a beautiful other son. I mean, I have two sons and a daughter, and I think about one of my children not being there. And the fact that this man has just stood up and, he's advocating and he's okay because he doesn't want this to happen to someone else. I don't want it to happen to someone else. I didn't want it to happen to someone as nice as him. I can't wait to meet him and give him a hug and to tell him that I'll keep fighting. And I hope everyone is listening and will fight for that next week when this bipartisan bill, gets unveiled. And we can keep playing this clip again and again until the Pharmacists Fight Back Act gets over the line. And we have parity for independent pharmacists, the kind who give the care to people instead of just sending them out without an alternative, that we have the ability for them to stay open, that we have the inability for PBMs to steer and manipulate their terrible vertical integrated complexes, that we have more people that understand why the drugs cost so much in the first place. So sorry, I got a little emotional there.
No,
I
you're
think it's the
good.
mom up there that came out in me.
No, and you invited us all into this war. So you're fighting, but how can we all fight? How can our listeners fight? Like, what can we do to help support this bill and this initiative?
Well, I think there's going to be a lot of press coming out about this pretty soon. I'll be talking about it on my Twitter page. My handle is at @mass_Marion. I bet Mark Cuban's going to be talking about this. Mark Cuban has a viable alternative to a lot of medications in that he has a price. He's cut out these middlemen, and people can buy directly from him for many drugs. So that's a wonderful thing. Um, I think you should be looking for more news on this bill. Find an independent pharmacist in your community. Ask them about this. Ask them if they know. Ask them about PBMs. If you know someone who's on a prescription drug and they're paying for a lot, ask them if they know how much the PBM is costing them. Ask them to start reading about PBMs. Ask them to start reading about the vertical integration to the insurance companies. Ask them to call their congressmen, to call both senators, ask for town halls. Let's have some open town halls and talk about why this is going on. And by the way, when they have the town halls, how about they put some patients up there on the stage? How about they put a nurse? How about they put a doctor? How about they put a pharmacist? Have a whole panel, and maybe the lawmaker. You're very kind. You can tell I love to talk. You're doing a great job at listening to me. But maybe if we had more lawmakers, instead of running at the mouth, that allowed their patients, their pharmacists, their physicians, uh, their um, their other people in their community to get up there and actually do the talking, maybe they'd learn a little bit. So advocate for that, because it's not them in the Capitol that they're not supposed to be working for themselves or these big corporations. They're supposed to be working for we, the people. It's us, and it's got to be us that drives the bus.
I love that. I would love to put together a town hall meeting to invite people, even in just to the, District 1 of Arizona, and we can do a panel and you could talk and let's get some others on there as well and just have it all around healthcare reform. But any of the other congressmen or senators that are listening, definitely reach out to Marion and she'll get connected with others for you for that town hall meeting, because we need the conversation to get louder, and therefore we can have more transparency and affordability for this huge baby boomer generation that's starting to retire, and we can do it. I think it sounds like we got to get rid of all of the fat and all of the fraud that's transpired, and allow for more free market localization, and allow for people that really care about us to actually have the care given to us, preventive, and be able to make this healthcare system incredibly better. So, Marion, if there's any other closing remarks, I'd love to just leave it at this. And we could do another episode because I know you got some other exciting events to go to and we want to hear those updates. But I'd love to give you just another minute or two with any other closing remarks.
Okay, you know what? Politico called this the month of health, HELLTH. Frankly, I think this can be we the people's finest hour, right? Like, let's think about Apollo 13. Let's take this to the moon. Let's do the real moonshot. Let's make this about us, what we need, because we should have a healthcare system that is based on we the people and our needs, the care that we have given to us. What we need to do is we need to open the books on where the money's flowing. We need to open the books on the conflicts of interest. We need to look at those things, make an assessment, and cut out as much fat as we can so that we can then understand what we're paying, and then we all become consumers. We need to cut the glut of the regulations that are stringing all of us up so that we can't get to you, the patient, so that we don't have all this paperwork that's in our way. And lastly, we need to make sure everyone plays by the same rules. This nonsense of only certain people are allowed to own hospitals and certain people are knocked out. That's ridiculous. This nonsense that big PBMs can collect kickbacks and the big hospital middlemen GPOs also can, but no one else in America can collect kickbacks. We're letting a bunch of virtual crooks the right to run a cabal. Are you kidding me? And by the way, where is the FTC? No one has been stopping this horrific vertical integration, and it needs to stop. So open the books on the conflicts of interest and on the money, cut the glut of all the regulation and all the nonsense that's hamstringing us, and make everyone play by the same rules. Let's get this done. We the patients, we the people, baby.
Marion, I love it. Thank you for a very meaningful conversation, and we'll see you on the next episode.
All right. Take care.